If your legs swell by evening and the puffiness creeps higher every month, what you are seeing is not normal aging. It is a mechanical failure happening inside your body right now. 70% of adults over 50 with swollen legs have a condition most doctors never name out loud. It is called chronic venous insufficiency, and it means the plumbing in your legs is breaking down. This video is for education only and does not replace medical advice. Always consult your doctor before starting any exercise or changing your treatment. Now, let me show you what is actually going on. You have a second heart, not a metaphor, not a figure of speech. A real biological pump buried in the muscles of your calves that pushes blood upward against gravity every time you take a step. When you walk, your calf muscles squeeze the deep veins inside your lower legs. That squeeze generates enough pressure to launch blood all the way from your ankles back up toward your chest. Tiny one-way valves inside those veins snap shut behind the blood to prevent it from falling back down. Muscle squeezes, valve closes, blood rises. That is the calf muscle pump in action. This pump is responsible for returning more than 60% of the blood volume in your lower body back to your heart. Without it, gravity wins. Fluid pools. Your legs pay the price. After 50, three things start failing at once. Your calf muscles lose mass. The valves inside your veins get weaker, and you sit for longer stretches without realizing the pump has stopped working. When the pump stalls, blood pools in the veins near your ankles. Pressure builds inside those vessels. Fluid starts leaking through the capillary walls into the tissue surrounding your legs. Your kidneys detect something strange. They sense that fluid volume in your bloodstream has dropped even though it has not really disappeared. It just moved into your tissue where the kidneys cannot track it, so the kidneys respond by holding on to more sodium and more water. They are trying to refill a tank that is not actually empty. This dumps even more fluid into your circulation and makes the swelling worse. Now you have a feedback loop. The pump fails, fluid leaks out, kidneys overcompensate, more fluid enters the system. More fluid leaks out. The swelling climbs from your ankles toward your knees. Millions of adults over 50 wake up fine and go to bed with legs that feel heavy, stiff, tight, and visibly swollen around the ankles. Most assume it is just what happens when you get older. But swelling is not a birthday gift your body gives you at 50. It is a signal, a warning light on the dashboard of a machine that is running out of pumping power and nobody is checking under the hood. Some medications make it worse, and you may not even know. Calcium channel blockers like amlodipine, commonly prescribed for blood pressure, can cause your capillaries to become leakier than normal. Certain Parkinson's medications, and even some drugs for Alzheimer's, are linked to lower leg swelling. If your swelling appeared shortly after starting a new medication, that connection is worth discussing with your doctor. Excess body weight adds load to an already struggling pump. The veins in your legs now carry more pressure from above while the valves fight gravity from below. The system was not designed for that combination, and here is what catches people off guard. You can eat well, manage your blood pressure, take your vitamins, and still develop swollen legs because the pump itself was never part of your health routine. Nobody teaches you to maintain your calf muscle pump. Your doctor checks your heart, your blood pressure, your cholesterol, but the second heart in your legs almost never gets a direct checkup. Meanwhile, the swelling is not just cosmetic. Stretched skin becomes fragile. Tiny tears heal slowly in older adults. Infections can enter through those cracks and turn a mild puffiness into a medical event. When fluid sits in tissue for weeks, the tissue itself starts to change. Skin thickens, color shifts. A brownish discoloration can appear near the ankles. That is called stasis dermatitis, and it means the swelling has been there too long. Left unchecked, the pressure from trapped fluid can eventually cause open wounds called venous ulcers near the ankle. These ulcers are painful, slow to heal, and prone to recurring infections that affect quality of life. So the question is not whether swollen legs matter, they do. The question is, what exactly is failing? And whether you can restart the mechanism that was designed to prevent this from happening in the first place, the answer is yes, and it does not require surgery, expensive compression equipment, or a gym membership. It requires 3 specific movements that directly activate the pump your legs have been missing. Let me walk you through exactly how your calf muscle pump works so you understand why these 3 moves matter. It starts at the bottom of your foot before your calf even fires. When your heel strikes the ground during a step, blood pools in the veins of your foot. As your weight rolls forward to the ball of your foot, those veins compress and shoot blood upward into your calf. This is called the foot pump, and it acts as a starter motor for the entire system. Without this initial push from below, the calf muscles above have less blood to work with and less pressure to build. The blood from your foot enters the deep veins of your calf. These are surrounded by 3 muscle compartments. The largest is the soleus, a wide, flat muscle designed for slow, sustained contraction during standing and walking. When the soleus and gastrocnemius muscles contract, they compress the deep veins from the outside like squeezing a tube of toothpaste. Blood is forced upward past the one-way valves toward your thigh. When those muscles relax, the valves snap shut to prevent backflow. The veins refill from below. Then the next contraction squeezes again, contract, valve closes, blood rises, relax, refill, repeat. Research shows this pump can drop the pressure in your foot veins by 60 to 80% during walking. That pressure drop is what keeps fluid inside your vessels and out of your tissue. But after 50, the soleus muscle begins to shrink. Studies suggest adults can lose 3 to 8% of muscle mass per decade after 30. The calf is one of the first regions to weaken with inactivity. A weaker calf muscle generates a weaker squeeze. A weaker squeeze means less pressure. Less pressure means blood does not rise as high. The valves still work, but the force behind them fades, and the valves themselves age too. The leaflets inside your veins are made of collagen. Over time, collagen degrades. The leaflets become floppy. They no longer seal completely. Blood begins to leak backward between squeezes. When blood leaks backward through incompetent valves and collects in the lower veins, the pressure inside those veins stays elevated even during walking. This is called ambulatory venous hypertension. Ambulatory venous hypertension is the technical name for the mechanism behind most chronic leg swelling in adults over 50. It means the pressure that should drop when you walk stays dangerously high. That sustained pressure pushes fluid through the walls of your smallest blood vessels, the capillaries, and into the tissue around your ankles and shins. This is the exact moment swelling becomes visible. And here's the part most people never hear. The lymphatic system is supposed to drain that excess fluid. But when the load exceeds the lymphatic capacity, the drainage system falls behind and fluid accumulates faster. So you now have 3 failures stacked on top of each other. The calf pump is weak, the valves are leaking, and the lymphatic drainage cannot keep up. Each one makes the other 2 worse. Sitting all day is like turning the pump off entirely. No muscle contraction means no squeeze. No squeeze means blood sits in the veins, fluid leaks steadily. Your legs swell hour by hour and you feel the heaviness build. Standing in one spot is almost as damaging. Your muscles are engaged enough to stay upright, but not contracting rhythmically enough to activate the pump. Blood pools just as it does during prolonged sitting. Even crossing your legs compresses the veins behind your knee and restricts flow. That single habit can worsen swelling over time because it adds a mechanical blockage on top of an already weakened pump. The feedback loop continues beneath the surface. Your kidneys sense reduced blood flow and hold more sodium. More sodium means more water retention. More fluid enters the bloodstream, more fluid leaks out at the ankles. Salt reduction helps break part of this loop. Elevation helps drain fluid temporarily. Compression stockings help squeeze from the outside, but none of these fix the root cause. The pump itself needs to be reactivated. The good news is, The calf muscle pump responds to targeted exercise at any age. Studies show that even gentle rhythmic contractions of the calf and surrounding muscles can measurably improve venous return within days. You do not need heavy weights or intense cardio. You need specific activation patterns that mimic the squeeze and release cycle the pump was designed to perform. 3 movements cover the entire mechanism. These 3 exercises target the foot pump, the calf pump, and the upper leg drainage pathway. Together, they address every stage of the return system from ankle to hip. Each one takes less than 2 minutes before I show you the moves. Understand one thing: consistency matters more than intensity. Doing these 3 times a day for 1 week will produce more visible results than one aggressive session followed by nothing. Let me show you the research behind each of these 3 moves so you know this is not guesswork. Every exercise targets a specific part of the venous return system and has clinical support behind it. The first move is the ankle pump. You lie down with your legs elevated on a pillow. Then you point your toes toward your head and then push them away from your head, alternating back and forth. Each time you pull your toes toward your head, you contract the muscles in the front of your shin. When you point your toes away, you activate the calf muscles behind your leg. Together, they create a rhythmic squeeze. The National Library of Medicine describes this movement as utilizing the calf muscle pump function to push blood toward the heart by muscle contraction. It is one of the simplest and most effective ways to fight edema. Research shows ankle pumps are also used in hospitals after surgery to prevent deep vein thrombosis. Surgeons prescribe them because they know this movement activates the exact pump that stops dangerous blood pooling. The target is 30 repetitions, 3 times a day. Each rep takes about 2 seconds. The entire set takes about 1 minute. You can do it in bed before you get up in the morning and before you sleep at night. If you have been watching this far and learning something you did not know about why your legs swell, take a moment to subscribe. This channel breaks down health information that matters for your body after 50. The second move is the knee to chest pull. You lie on your back and slowly bring one knee toward your chest as far as comfortable. Hold for a moment, then lower it back down and switch to the other leg. This movement targets the thigh and hip. By compressing the thigh against the abdomen, you create pressure that moves stagnant fluid from the upper leg into the abdominal cavity where the lymphatic system can process it. Think of the knee to chest pull as clearing the upper highway. The ankle pumps push blood up from the calves, but if the thigh veins and lymphatic channels are congested, that blood has nowhere to go. The knee to chest pull opens the drainage route above the calf. It shifts fluid that has been sitting in the thigh and hip region and helps it move toward the kidneys where it can be filtered and eliminated. The target is 10 repetitions per leg, 3 times a day. Keep the resting leg bent with the foot flat on the surface to protect your lower back. If bringing the knee fully to your chest is uncomfortable, bring it halfway. Physical therapists recommend this movement for elderly patients recovering from hip replacement and for anyone with lower body edema because it promotes circulation through the entire chain from ankle to torso. The third move is the glute squeeze. You sit in a chair or lie on your back. Tighten the muscles in your buttocks as hard as you can. Hold for 5 seconds, release, then repeat. This one surprises people because it does not seem like a leg exercise, but the glute muscles connect to the major veins and lymphatic vessels in your pelvis. When you squeeze them, you pump fluid from the entire lower body upward. The gluteal squeeze creates a wave of pressure from the hip that cascades down through the thigh and helps pull stagnant fluid centrally. It works like a suction pump at the top of the pipeline while the ankle pumps push from below. 10 repetitions, 3 times a day. Hold each squeeze for 5 seconds. You can do this in any chair, in your car, at the kitchen table, or lying in bed. No one will even know you're exercising. When you combine all 3 moves, you activate the full return chain. The ankle pump pushes blood from the calf. The knee pull clears the thigh. The glute squeeze pulls everything toward the center for processing, foot to calf, calf to thigh, thigh to hip to kidneys. The fluid moves through the system in a complete circuit that mimics what walking used to do naturally before the pump weakened. Many people report visible reduction in ankle swelling within the first 3 to 5 days of doing these exercises consistently. The fluid that was trapped begins to move, and the kidneys begin eliminating the excess through urine. You may notice that you visit the bathroom more frequently when you begin this routine. That is a good sign. It means the fluid that was sitting in your tissue is now being processed and removed from your body. Combining these exercises with leg elevation for 15 minutes after each session enhances the effect. Gravity assists the pump. Position your legs above heart level using pillows and let the fluid drain while the muscles recover. Eating magnesium-rich foods like leafy greens, nuts, seeds, and whole grains supports healthy vein function. Magnesium helps maintain the elasticity of blood vessel walls, which keeps the valves and capillaries working properly. Reducing processed food and excess sodium decreases the amount of fluid your kidneys retain. When you combine dietary changes with the 3-pump exercises, you attack the problem from both the mechanical and chemical sides simultaneously. Here's your daily protocol. This takes less than 10 minutes, and you can do it at home without any equipment. Morning, midday, and evening. 3 rounds, 3 moves per round. That is the entire system, morning round. Before you get out of bed, lie flat with your legs on a pillow. Start with 30 ankle pumps, toes toward the head, toes away, back and forth, 1 minute, and your calves are firing. Next, bring your right knee toward your chest. Hold for 2 seconds, lower it. Bring your left knee up. 10 reps per side. Keep the resting leg bent to protect your lower back throughout the movement. Then squeeze your glutes. Tighten hard, hold 5 seconds, release 10 times. By the time you're done, you have spent about 4 minutes in bed and activated every part of the return chain before your feet even touch the floor. Starting the day with these 3 moves means your pump is primed before gravity has a chance to stack fluid in your lower legs. Most swelling builds during the day. This routine gives you a head start against it. Midday round, find a chair, sit upright. Do the ankle pumps with your feet flat on the floor. Point your toes up by lifting the front of your foot. Then push down onto your toes. 30 reps. You cannot do the knee to chest pull in a chair, but you can do a seated version by lifting one knee toward your chest while sitting. Grab behind the thigh with both hands and pull gently, 10 per side. Then squeeze the glutes right there in the chair. Nobody around you will notice. Tighten, hold 5 seconds, release 10 times. This midday session breaks the cycle of prolonged sitting that shuts down the pump. If you sit for your job or spend most of the afternoon in a chair, this midday round is the most important one. Hours of sitting without muscle contraction is the single fastest way to accumulate fluid in your legs. Even standing up and walking for 2 minutes every hour helps. But the 3-move protocol is specifically designed to activate the deep venous pump in a way that casual walking does not always achieve. Evening round. Lie on the bed or couch. Elevate your legs on 2 or 3 pillows so they are above your heart. Do all 3 exercises in this position. The elevation combined with muscle activation maximizes drainage. After the exercises, keep your legs elevated for an additional 10 to 15 minutes. Let gravity do the passive work while your muscles recover. This is when the fluid moves the fastest back toward your center. If you wear compression stockings, put them on in the morning before swelling starts, not at night after the legs are already puffy. Compression works best as prevention, not as treatment after the fluid has already accumulated. Talk to your doctor before purchasing compression stockings because the wrong pressure level can restrict blood flow and cause more harm than benefit. A healthcare professional can prescribe the correct grade for your condition. Stay hydrated throughout the day. It sounds counterintuitive, but dehydration triggers your kidneys to retain even more sodium and water. Drinking enough water actually helps your body release the excess fluid it is holding on to. Watch your sodium intake carefully. Processed foods, canned soups, deli meats, and restaurant meals contain more sodium than most people realize. Even a single high-sodium meal can trigger noticeable swelling the next morning. Track your swelling. Measure the circumference of your ankles at the same time every morning and every evening. A simple cloth tape measure gives you objective data to show your doctor and helps you see whether the protocol is working. Expect results within 3 to 7 days if you follow the protocol consistently. The first sign is usually softer tissue around the ankles in the morning. Then the evening puffiness starts to decrease. Then shoes fit more comfortably. If the swelling does not improve after 2 weeks of consistent effort, that is important information. It could mean the cause of your edema is not purely mechanical, and your doctor should investigate further with blood work and imaging. Do not increase the intensity of these exercises aggressively. More is not always better. The goal is gentle rhythmic activation, not maximum effort. Pushing too hard can strain muscles that are already deconditioned after years of inactivity. Walking remains the best overall exercise for venous health because it activates the full foot pump, calf pump, and thigh muscles in a natural sequence. Aim for 20 to 30 minutes of walking daily, in addition to the 3-move protocol. Avoid sitting with your legs crossed for extended periods. This compresses the veins behind your knee and restricts flow through the exact vessels the pump is trying to clear. Keep both feet flat on the floor when seated. Sleep with a thin pillow under your ankles so your legs are slightly elevated even at night. This small change helps prevent fluid from pooling during the 8 hours when your pump is completely inactive. Write the 3 moves on a card and put it on your bedside table. Ankle pumps, knee to chest pulls, glute squeezes, morning, midday, evening, 10 minutes total. Your second heart needs this daily restart to work properly. Now, I need to tell you when this protocol is not enough and when swelling means something more serious is happening inside your body. These warning signs require immediate medical attention. If the swelling is only in one leg, call your doctor immediately. One-sided swelling with pain, warmth, and redness in the calf or thigh could be a deep vein thrombosis, which is a blood clot that can travel to your lungs. Deep vein thrombosis is a medical emergency. Do not massage the leg. Do not exercise the leg. Do not wait for it to improve. Go to the emergency room or call your doctor right away. This is not something to watch at home. If your swelling is accompanied by shortness of breath, chest pain, or difficulty breathing, seek emergency care immediately. These symptoms could mean the clot has moved to your lungs, which is called a pulmonary embolism. Swelling that comes with fever, increasing redness, and skin that is hot to the touch could be cellulitis. This is a bacterial infection in the skin that requires antibiotics. It spreads quickly in skin that has been stretched and thinned by chronic edema. If you press your finger into the swollen area and a deep pit remains for several seconds after you release, that is called pitting edema. It suggests significant fluid retention that may be linked to heart, kidney, or liver conditions. Pitting edema always warrants a medical evaluation. Your doctor will likely order blood tests to check kidney function, liver enzymes, and protein levels. They may also check your heart function with an echocardiogram. Swelling that worsens quickly over a few days, rather than building gradually over weeks, could indicate a medication reaction. Common culprits include certain blood pressure medications, steroids, and anti-inflammatory drugs. If your swelling started within days of beginning a new prescription, do not stop taking the medication on your own. Call your doctor and report the symptom. They may adjust the dose or switch you to a different drug. Brownish discoloration of the skin near your ankles is a sign that swelling has been present for a long time. The discoloration comes from red blood cells leaking through damaged capillaries and depositing iron pigment in the tissue. This discoloration is called stasis dermatitis, and it means the chronic pressure in your veins has been damaging the skin for months or even years. At this stage, the risk of venous ulcers increases significantly. Venous ulcers are open wounds that form near the ankle when prolonged swelling destroys the skin's ability to heal itself. They are painful, slow to close, and frequently become infected. Prevention is far easier than treatment. If you see any open sore on your lower leg that does not heal within 2 weeks, see your doctor. Do not treat it at home with bandages alone. Venous ulcers require professional wound care and compression therapy under medical supervision. For those managing diabetes alongside swollen legs, the combination requires extra caution. Diabetes reduces blood flow to the extremities and impairs nerve sensation. Swelling plus reduced sensation means injuries go unnoticed longer. Check your feet and lower legs daily if you have diabetes. Look for redness, sores, blisters, or changes in skin temperature. Catching problems early prevents the complications that lead to hospitalization and long recovery periods. Heart failure is one of the most serious causes of bilateral leg swelling in adults over 50. If your swelling is accompanied by rapid weight gain, fatigue, and difficulty lying flat to sleep, your heart may be struggling to pump efficiently. This does not mean every person with swollen legs has heart failure. Most do not, but persistent swelling that worsens over weeks and does not respond to elevation or exercise deserves a thorough cardiovascular evaluation from your doctor. Kidney disease can also cause leg swelling because the kidneys lose their ability to filter excess fluid and sodium. If you have high blood pressure, diabetes, or a family history of kidney problems, mention your swelling at your next appointment. Liver disease, particularly cirrhosis, impairs the production of albumin, a protein that keeps fluid inside your blood vessels. Low albumin levels cause fluid to leak into tissue throughout the body, especially in the legs and abdomen. The point is not to scare you. The point is to give you a clear map of what swollen legs can mean, so you take the right action at the right time, instead of ignoring a signal your body is sending you. For the majority of adults over 50, swollen legs are caused by an underperforming calf muscle pump made worse by inactivity, age-related valve changes, and dietary sodium. The 3-move protocol directly addresses these root causes. Start today, not next week, not when the swelling gets worse. Today, ankle pumps, knee to chest pulls, glute squeezes, 3 rounds a day. Your second heart is waiting for you to turn it back on. If this video helped you understand something about your body that no one has explained before, leave a comment and tell me which part surprised you the most. Your comments help this channel reach more people who need this information. And subscribe so you never miss a video that could change how you take care of your body after 50. I will see you in the next one. Take care of yourself. Your legs are trying to tell you something. Listen.